ನ್ಯೂರೋ ಪಾಸಿಟಿವ್ ಆಗಿತ್ತು. ಇವರಿಗೆ ಹಾರ್ಟ್ ವೀಕ್ನೆ ಅಂದರೆ ಈಗ ಶಿ ಹ್ಯಾಡ್ ಇಸ್ಕಿಮಿಕ್ ಹಾರ್ಟ್ ಡಿಸೀಸ್ ಅಲಾಂಗ್ ವಿತ್ ದಿಸ್ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್. ನಾವು ಅದಕ್ಕೆ ನಮ್ಮ ಇದರಲ್ಲಿ ಇಟ್ಬಿಟ್ಟು ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಕಾರ್ಡಿಯಾಲಜಿಸ್ಟ್ ಬಂದು ಅವ್ರು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟು ಇಸ್ಕಿಮಿಕ್ ಹಾರ್ಟ್ ಡಿಸೀಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಜೊತೆ ಕೋವಿಡ್ ಕೊಟ್ಟು ಈಗ ಗುಣಮುಖರಾಗಿ ಮನೆಗೆ ಹೋಗ್ತಾ ಇದ್ದಾರೆ.
We had read it in the books, like a pandemic is like it occurs around the world at the same time. But literally, like nobody had faced the pandemic priorly. So the first COVID case came, it was so scary. Like everybody, like even treating physicians were scared, anesthetists, everybody for OBG people.
During the second wave, we had more difficult situations. Availability of beds, availability of oxygen, availability of medicine, especially remdesivir medicine. Demand was there, more patients were scared, everybody was in enough and was in need of oxygen at that time.
There was a health emergency in India during the COVID times. Our public health infrastructure was not at all prepared, especially North Karnataka, which had the highest difficulty due to dearth of the health infrastructure. There are many issues in these North Karnataka hospitals.
To create awareness, district administration and foundation were adopted various strategies like providing medical diagnosis equipment and training on the equipment how it should be used as a precautionary strategies to avoid COVID in second wave. With the help of healthcare workers, Anganwadi workers, slum board members and GP task force members, we could able to reach 50 lakh people in 6 districts. Around 667 gram panchayatis were involved in this.
ಆ ಟೈಮಲ್ಲಿ ಸ್ಕ್ರೀನಿಂಗ್ ಫೀವರ್ ಪಾಸಿಟಿವ್ ಬಂದ ತಕ್ಷಣ PCSC ಪ್ರೈಮರಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಸೆಕೆಂಡರಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಅವ್ರನ್ನೂ ಟೆಸ್ಟ್ ಪಡ್ಲಿಕ್ಕೆ ಭಯ ಪಡ್ತಿಲ್ಲ. ಭಯ ಇತ್ತು ಕಾಂಟ್ಯಾಕ್ಟ್ ಟ್ರೇಸಿಂಗ್ ಅಂದ್ರೆ ಫಸ್ಟ್ ಇಮಿಡಿಯೇಟ್ಲಿ ಯಾರಾದ್ರೂ ಒಂದು ಮನೆಯಲ್ಲಿ ಪಾಸಿಟಿವ್ ಬಂದ ತಕ್ಷಣ ಇಮಿಡಿಯೇಟ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಲೈಕ್ ದೇರ್ ರಿಲೇಟಿವ್ಸ್ ಆರ್ ನೇಬರರ್ಸ್ ದೇ ಯೂಸ್ ಟು ಫಿಯರ್ ದಟ್ ಅವ್ರಿಗೆ ಪಾಸಿಟಿವ್ ಬಂದಿದೆ ಮತ್ತೆ ನಮ್ಗೆ ಟೆಸ್ಟ್ ಮಾಡ್ತಾರ ಅಂತ ಇರುತ್ತೆ.
ನಾವು 40-45 ಸಾವಿರ ಪಾಪ್ಯುಲೇಷನ್ ಆ ಟೈಮ್ದಾಗ ಕವರ್ ಮಾಡಿದ್ವಿ. ಒಂದು 600ರಿಂದ 700 ಮನೆಗಳನ್ನ ಸರ್ವೆ ಮಾಡಿದ್ವಿ. ಆ ಟೈಮ್ದಾಗ ನಮಗೆ ಪಾಸಿಟಿವ್ ಕೇಸು ಒಂದು ಮನೆ ಒಳಗೆ ಒಂದೇ ಟೈಮ್ ಎಟ್ ಎ ಟೈಮ್ ನಮಗೆ 2-3 ಪಾಸಿಟಿವ್ ಕಂಡು ಬಂದ ತಕ್ಷಣ ಅವ್ರ ಮನೆಯವ್ರನ್ನೆಲ್ಲರನ್ನೂ ಶಿಫ್ಟ್ ಮಾಡುವಂಥ ವ್ಯವಸ್ಥೆನ ನಾವು ಆಂಬುಲೆನ್ಸ್ ಕರೆಸಿ ನಾವು ಶಿಫ್ಟ್ ಮಾಡಿದ್ವಿ.
ಅಜೀಮ್ ಪ್ರೇಮ್ಜಿ ಫೌಂಡೇಶನ್ ಕಡೆನಿಂತ ಪ್ರೈವೇಟ್ದವ್ರು ನಮ್ಗೆ ಕೊಟ್ಟಿರ್ತಿ ಅಂದ್ರೆ ಆಶೋದವ್ರಿಗೆ ಕೊಟ್ಟರೆ ಎಲ್ಲ ಮರಿಗೆ ನಮಗೂ ಬೇರೆ ಬೇರೆ ಕಡೆ ಆಶೋದವ್ರಿಗೆ ಕೊಟ್ಟಾರೆ. ಅಂದ್ರೆ ಇದು ಇದು ಪಲ್ಸ್ ಚೆಕ್ ಮಾಡೋದು ಅಂದ್ರೆ ಇದು ಲಾಡಿ ಬಿಡಿತಂತ ಅದು ಚೆಕ್ ಮಾಡೋದು ಆಯ್ತು. ಇದು ಥರ್ಮಲ್ ಗನ್ ಅಂತಿದ್ದು ಅಂದ್ರೆ ಜ್ವರ ಅದು ಕೋವಿಡ್ ಟೈಮ್ನಾಗ ಟೆಸ್ಟ್ ಮಾಡಿವಿಲ್ಲ ಎಲ್ಲರಿಗೂ ಮಾಡ್ತೀವಲ್ಲ.
ನಾವು ಮನೆಗೆ ಹೋಗಿ ಚೆಕ್ ಮಾಡ್ತಿದ್ವಿ. ರೂಮ್ಗೆ ಹೋಗಿ ಎಲ್ಲಾ ಮಕ್ಕಳಿಗೆ ಹಿಡ್ಕೊಂಡು ದೊಡ್ಡವ್ರ ತನ ಎಂತ ಕ್ರಿಟಿಕಲ್ ಕಂಡೀಷನ್ ಇದ್ರು ಅವರಿಗೆಲ್ಲ ತೋರಿಸಿ ಮಾತಾಡಿಸಿ ಅವ್ರ ವಿಚಾರಣೆ ಎಲ್ಲ ಕೇಳಿ ಅವರಿಗೆ ಶುಗರ್ BP ಎಲ್ಲ ಚೆಕ್ ಮಾಡಿ ಆಮೇಲೆ ಹೇಳ್ತಿದ್ವಿ ಅವ್ರಿಗೆ ನಿಮ್ಗೆ ಶುಗರ್ ಇದೆ, ನಿಮ್ಗೆ BP ಇದೆ, ಯಾವ ತರ ನೀವು ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಳ್ಬೇಕು ಅಂತೇಳಿ ಎಲ್ಲ ಅವರಿಗೆ ಸಲಹೆ ಕೊಡ್ತಿದ್ವಿ. ಅವರಿಗೆ ಎಷ್ಟು ಟೆಂಪರೇಚರ್ ಇದೆ ಅವರೆಲ್ಲ ರೆಕಾರ್ಡ್ ನಮ್ಮಲ್ಲೇ ಇರ್ತಿತ್ತು.
We had to keep patients separately for COVID, separate entrance, separate pharmacy, separate investigations. Everything, it's like a one more hospital you are building in the hospital. We had to make it.
In our area, yes, it's very difficult to wear PPE and go inside. That too with pack, everything, double mask, double head shield, with PPE full covered, no ventilation only. They will come like this, breathlessness, they will come out. They used to come out. All staff were cannot wear more than 4 hours, more than 2 hours also PPE during summer seasons and all. Sweating like anything. They are afterwards last they used to go without PPE only.
Staff gone to their home also because this contamination to their family members and the elder parents. They used to stay back at hospital available rooms. Extraordinary services they have given.
Bioseptic cabinet.
Here the process is started. After 25 minutes, we will get the RNA here.
T-Fisher Flex automated RNA machine. Previously, we are doing manually. It's very difficult to do it. Facing a lot of problems. Now we are very easy to do it. At a time, we will get 470 samples at a time. We can process them minimum thousands together. We can do it here at a time. Previously, we can do it maximum 300. 300 to 500 we get that is maximum. Next we are done in 4,000.
We had only 12 or 36 capacity. Imagine 36 capacity every time, and it takes almost 4 hours in that. And we did not have automated extractor. There were 48 hours we needed to give one report. We requested for automated extractor. And Azim Premji's was the first foundation who helped us to get this equipment of testing, that is RT-PCR testing. Was that we got immediately, and later on started getting from government as well as ICMR.
During the second wave,
Yes.
We had more difficult situations, shortage of oxygen. For that, with the help of the district administration and other sister departments, we could manage the oxygen situation also. The private oxygen plants also under the control of district administration. Tasildars were deputed in those areas who were monitoring regularly on 24/7 rotation basis. They were there. Even the revenue department people were also with us in those situations for to see that the genuine supply of oxygen is done to all the hospital where it is actually needed.
During this phase, the demand for oxygen was the major crisis, and the foundation could step in to provide at least 7 PSA plants in 5 districts of Northeast Karnataka, some of which had to be built ground up. We also helped in installing a large liquid medical oxygen plant in Kalburgi.
We started to use more and more of HFNC machines. More we used the ventilator, it was not that good outcome we found. The more we used the HFNC, we had a good outcome.
Having very minimal ICU facilities, then the DC and the foundation, they worked on that. So 10 ICU beds and with the ventilators, they were established. And totally in the first wave itself, they got about 20 ICU facilities here in this hospital. These are the facilities that are established here.
ಸಮಯದಲ್ಲಿ ಡೆಲಿವರೀಸ್ ಕೂಡ ಬಹಳ ಚಾಲೆಂಜ್ ಇದೆ ನಮಗೆ. ತಾಯಂದಿರು. ಡೆಲಿವರೀಸ್ ನಾವು ಅಂಥ ಡೆಲಿವರೀಸ್ ನಮ್ಮ ಸ್ಟಾಫ್ ನರ್ಸ್ ತಾಲೂಕು ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಆ ತಾಯಿ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಇದ್ದರೂ ಕೂಡ ನಮ್ಮ ಸ್ಟಾಫ್ ನರ್ಸ್ ಡೆಲಿವರಿ ಮಾಡಿದ್ದಾರೆ. ಸೊ ಸಪ್ರೇಟಾಗಿ ನಾವೊಂದು ಸೆಪ್ಟಿಕ್ ವಾರ್ಡ್ ಅಂತ ಮಾಡಿದ್ದೀವಿ ತಾಲೂಕು ಹಾಸ್ಪಿಟಲಲ್ಲಿ. ಅಂಥ ಯಾರು ಗರ್ಭಿಣಿ ತಾಯಂದಿರಿದ್ರು ಅವರಿಗೆ ಇಲ್ಲಿ ನಾವು ಕರ್ಕೊಂಡು ಬಂದು ನಾವು ಡೆಲಿವರಿನೂ ಕೂಡ ಮಾಡಿದ್ದೀವಿ.
We intervened holistically with the public hospitals to enhance the health infrastructure, keeping the long-term utilization in mind in North Karnataka. There were no testing labs in many districts, shortage of equipments like RT-PCR machines or any extractors, and the severe issue of the ICU beds in the hospitals. Moreover, in the second wave, there were a crisis of the supply and availability of the oxygen and oxygen beds.
ಈ ಕೋವಿಡ್ ಸಮಯದಲ್ಲಿ ಗಮನಿಸಬೇಕಾದ ಮುಖ್ಯ ಅಂಶಗಳೆಂದರೆ ಮಾನವರು ಸಮರ್ಥರು, ಮಾನವತೆಗಾಗಿ ಅದು ಹೇಗೆ ಹೊರಹೊಮ್ಮುತ್ತದೆ ಎಂಬುದನ್ನು ಈ ಕೋವಿಡ್ ಸಂದರ್ಭದಿಂದ ತಿಳಿಯಬಹುದಾಗಿದೆ. ಜನರು ಧೈರ್ಯ ಮತ್ತು ನಿಸ್ವಾರ್ಥತೆಯನ್ನು ಹೇಗೆ ಪ್ರದರ್ಶಿಸಬೇಕೆಂಬುದನ್ನು ಇದು ನಮಗೆ ತಿಳಿಸಿದೆ.